This is Volunteer Radio. In the program Spotlight, now we bring you a discussion on cabinet decisions, expanding health infrastructure and focus on farmers' welfare. The participants are Shekhar Iyer, political analyst, and Neelab Srivastav, journalist.
Cabinet meeting under the chairmanship of the Prime Minister was held on Thursday. While such meetings are usual and regular, but what was new was that it was the first such meeting after the NDA government had its first cabinet reshuffle on Wednesday, after the Council of Ministers under Prime Minister Narendra Modi had taken charge of their second term in May 2019. Now the new Council of Ministers has 36 new faces and a total of 43 new and old ministers were sworn in by the President at the Rashtrapati Bhavan, and a total of 15 ministers in the cabinet rank and 28 in the Ministers of State rank took the oath that day. The ground was hit running soon, and a briefing of the cabinet decisions was also done by the new Health Minister, Mr. Mansukh Mandavia, the Agriculture Minister, Mr. Narendra Singh Tomar, and Sports and Information Broadcasting Minister, Mr. Anurag Thakur. There were four broad decisions, and the four most important one was about the COVID-19 Emergency Response and Health Systems Preparedness Package, Phase 2, and the government has pegged an amount of over 23,000 crore rupees. Mr. Iyer, the COVID pandemic has not gone away. The cabinet has yesterday met. What is this Phase 2 package all about?
Indeed, Dilapji, as you rightly pointed out, this was the first meeting of the newly expanded Union Council of Ministers. And as we can see, the management of COVID-19 remains the top priority for the Prime Minister and the government. So therefore, we saw some very important decisions being taken. If you remember, in March 2020 last year, when we were facing the first wave of COVID-19 pandemic, the Prime Minister had announced a central sector scheme, that is central government directly spending about 15,000 crore for what was called emergency response to create that immediate health infrastructure that is necessary. And this was supposed to be done all over the country and for the pandemic management. Now, since February of this year, we are seeing a second wave which has spread into rural, peri-urban and tribal areas. So therefore, we saw on Thursday, the Prime Minister chairing this important cabinet meeting where they approved a second scheme, or what you can call, in fact, a new scheme, which is called for the phase 2 of this COVID management emergency response, as you mentioned. Now, this scheme aims to accelerate, preparedness in terms of creating hospital beds, creating oxygen supply lines, as well as other things that are required in terms of stocking of essential medicines and other health infrastructure. At the same time, they have also taken into account the need for health infrastructure development, keeping the welfare of children in mind. So therefore, this time there is a provision for pediatric care with very tangible outcomes which has been fixed. So these are the aspects of this scheme, which is what is under the central sector scheme, where about out of 15,000 crores, where center will directly spend on creating those infrastructure all over the states. And there is a second component which is called the centrally sponsored schemes, in which states will also chip in, and that is to the tune of 8,000 crores.
We get to hear various scientific assessments and the analysis by the medical experts also, Mr. Iyer, that there looks to be an impending third wave. However, this is coupled with the very fact that if we shun COVID-appropriate behavior, do not do what is required of us, like wearing masks and washing our hands and keeping distance, including also getting vaccination done for COVID-19. So keeping all these things in mind also, is that the thing somewhere behind in the entire planning for COVID management? Because God forbid, if there is something like what has happened in the second phase, we have seen that a lot of lack of medical oxygen for the patients. So is that also a concern, that a lot of stress on ensuring that the medical oxygen supply lines and the facilities is also created, so that in case it is required, we can be able to provide it as soon as possible to the patients?
Definitely, Nilabji, you are right, because the kind of experience we faced during this second phase has definitely, given us a lot of thoughts and need for some action plans. That is why even Prime Minister on Saturday specially chaired a meeting regarding oxygen supply. He chaired a high-level meeting on Saturday to review the ramping up of oxygen supply across the country. And for that, more than 1,500, these oxygen plants are coming up in different states. And these plants have been made from the PM Care Fund. So therefore, Prime Minister today instructed officials to ensure that these plants are made functional at the earliest, and as well as the hospital staff are given adequate training on maintenance of these plant, operation of plants. Because what we noticed during the pandemic, particularly the second wave, was many of the hospitals did not have an installed oxygen plant, which is actually they should have, which they did not do, and they were sourcing it from supply from other places. And also, whatever plants were functioning, they could not function also, or they were malfunctioning because the hospital staff were not fully trained. So therefore, the Prime Minister was very particular that we have technology is put to see and track the performance of these plants, and it is ensured that in a future situation, God forbid, if there is a demand for oxygenated beds, there will not be a crisis of the kind that we saw. Even if under this scheme, if you see, Nilabji, the support that is being provided for the various central hospitals under this 15,000 crore budget which I was talking, which is to ensure not only all the central hospitals, AIIMS, as well as other national importance like Safdarjung Hospital in Delhi or RML Delhi or hospitals in Imphal or Shillong or PG Mer in Chandigarh or JIPMER in Pondicherry. Now, the whole idea is whatever beds that are available, these beds are specially earmarked and at least 7,000 beds are ready for COVID management. At the same time, they also want to strengthen the National Center for Disease Control by providing, the genome sequencing machines. In fact, a number of pandemic experts and doctors have been saying we need to be doing this sequencing, which is very important to track the new variants that are coming, and we need what is called the epidemic intelligence services. We also need scientific control rooms with the new latest gadgets. So this money will be helpful. Similarly, very important component which the Prime Minister has always given emphasis is to have what is called the modern hospital information management system in all the district hospitals. See, because right now this new technology has been used in about 300 district hospitals. The Prime Minister wants all the district hospitals are covered under this hospital management information system that will give you on a real-time basis, what exactly is the position of bed availability, oxygen availability, intake of patients, patients under treatment, patients under critical care. This kind of real-time information helps in mobilizing the resources that are necessary. Similarly, we have seen during the pandemic, there has been a growing interest in what is called teleconsultation. A lot of people have been approaching doctors through tele apps. And the Government of India has encouraged what is called the e-Sanjeevani, teleconsultation platform. And the idea is that at least there should be 5 lakhs of teleconsultation per day, because at the moment there are 50,000 teleconsultations. So the idea is states and union territories are given whatever facilities and technical backup for these teleconsultation for COVID patients at the COVID care centers, and using this e-Sanjeevani teleconsultation. And the other idea is, I spoke about the emphasis on a modern scientific war room kind of approach. So the center wants to utilize this money for creating these war rooms in states and other places. Other aspect which we discussed, Nilabji, particularly about the pediatric care, which is a very important thing. The government wants to use the centrally sponsored budget of about 8,000 crore for creating at least pediatric units in at least 736 districts in all over the country, where you can have latest technology as well as mentoring is also possible using experts.
The package also talks about enhancing the fleet of ambulances in the country, and as per the government statement issued after the cabinet briefing was that 8,800 ambulances, the fleet of such ambulances will be enhanced, and also a number of medical students and nursing students will be engaged for COVID management. The other important decision, Mr. Iyer, in yesterday's cabinet meeting was about the agriculture infrastructure fund. Now, the central sector scheme, there have been some modifications, and this is primarily aimed to help the small and the marginal farmers. Also in the context is the ongoing agitation of the farmers, which is about 7-8 months at the Delhi's border now. And the government time and again has repeated that they are ready for talks on this and they have to come back to the talking table because the new 3 farm laws are in their benefit. Mr. Iyer?
Yes, Nilabji, you rightly pointed out yesterday's cabinet decision as a message for the farmers groups which are continuing to agitate without a purpose, without any clear strategy in their mind. Because what the government has been saying from day one is they are ready for discussion. Short of accepting their demand for repealing of the farm laws, government is ready to make whatever necessary amendments that they can suggest where they feel farmers' interests are better protected by some changes. Government is willing. You would recall a few days ago, we saw the NCP leader Sharad Pawar coming out with a statement saying that these farm laws should not be repealed, rather some changes have to be done, in fact backing the government line. And that drew a prompt response from our Agriculture Minister, Narendra Singh Ji Tomar, who said, we welcome statements like that has been made by Sharad Pawar Ji. So that position of the government remains. They are ready for changes. Now, given this context, yesterday's cabinet decision is calls for under the Agriculture Infrastructure Fund, which was announced last year. That is 1 lakh crore has been set apart for creating agricultural infrastructure, which is exactly concerning creating of cold storages, creating of transport machinery which can carry the agriculture produce to different markets. So what the government has done is now they have said this 1 lakh crore fund which provides for this interest subvention. Earlier there was a provision that only 25 projects can be covered. Now they have increased. There is a private sector intervention. Now what they have done is they've extended it to all the APMCs. So APMCs, the agriculture produce marketing committees. Government is sending a message agitating farmer groups that look, all this talk about the propaganda about that the APMC is being dismantled, the farmers will not get a right price. That is all a bunkum and total disinformation, because government has announced yesterday through this cabinet decision that they are willing to fund all these groups, including APMC, any federation of cooperatives, and also these farmers producers organizations, which are an important aspect of the farm laws, because these organizations can enter into commercial contract for taking up cultivation of important cash crops and also ensure a better price for the farmers. So yesterday's decision is significant from these reasons. And government has said, as far as agriculture produce marketing committees, interest subvention for a loan up to 2 crore will be provided for each project of different infrastructure type, whether it is setting up cold storage or for creating sorting units, grading units or assaying units. In the same market yard, they can take up each of these projects, and the government has okayed. They can take bank loan, and whatever interest is accrued, that will be taken care of by the central government.
This decision not only supplements as to what the government has said in the new 3 laws for the agriculture reforms, but also to ensure and to make a point that they are not going away, and that to strengthen this entire concept of FPOs and APMC. Was that also the reason behind the cabinet decision yesterday, Mr. Iyer?
Absolutely, because you see, whatever necessary changes are being made, because the government wants to ensure that these organizations are equally strengthened. Because the philosophy or the objective behind the farm laws was our farmers should have alternative markets. They should be able to sell their produce where they get a better price. So there will be APMC wherever there, which is very close to them. If they feel they can get a better price outside the APMC, they should have that opportunity. That was the idea. So strengthening that idea. So the modifications that were announced through the cabinet decision on Friday is to actually create a multiplier effect, so that this will generate more investment, more APMCs will be investing on all these facilities which will help farmers in the post-harvest situation. And because the idea is APMCs continue to provide very important key market linkages, and they are creating an ecosystem for public infrastructure which is available to all farmers. So therefore, this is a message to these misguided farmer groups who are claiming they have taken a position where unless you repeal laws, this propaganda-oriented, which is more politically motivated, is not helping the cause of the farmers.
There were a few other decisions that were approved by the cabinet yesterday. One, if I can just read out from the government statement, one was about cabinet approving the memorandum on cooperation between the Competition Commission of India and the Japan Fair Trade Commission. The cabinet approving the MOU between the Institute of Cost Accountants of India and the Association of Chartered Certified Accountants, which is in the United Kingdom. A third one was the cabinet approving an amendment in the Coconut Development Board Act of 1979 for making the Coconut Development Board as a non-executive chairman. In the last remarks before we sign off, Mr. Iyer, the COVID-19 management as such, it is very important now, because the scientists and doctors, everyone now also saying that it is not time to let your guard down, and we need to ensure the COVID appropriate behaviors and ensuring that also getting vaccinations whenever it is available. I think that is the most important point remains, Mr. Iyer.
We have to fight the pandemic, and the war is on. And all of us will have to take all the necessary precautions and also get ourselves vaccinated. At the same time, we should be expressing confidence in our own ability and in our country's strength to overcome this crisis. That is why all the decisions that the government is taking is to prepare for a situation in the near future where COVID will no longer be with us, and we will have the full benefit of an economy that will pick up again and will bring a lot of benefit to a lot of people.
Thank you very much for joining us, Mr. Iyer.
Thank you, Nilabji.
You were listening to a discussion on Cabinet Decisions, Expanding Health Infrastructure and Focus on Farmers' Welfare. The participants were Shekhar Iyer, Political Analyst, and Neelab Srivastav, Journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may email your opinion about this program at airnsdtalks@gmail.com.